Finland just blew a big hole in the lie of the youth gender medicine debate, and I'm going to walk you through the study today. For years, we've been told the very same thing, over and over, with absolute moral certainty from people in white coats and rainbow t-shirts. If a child says they're transgender, then the compassionate thing to do is to affirm it at all costs. Affirm the identity, affirm the new name, affirm the pronouns. And if that child is distressed enough, then affirm the drugs too. Puberty blockers, cross-sex hormones, eventually irreversible experimental cosmetic surgery. And why? Because we were told this was life-saving. We were told it improves mental health. We were told the only alternative was suffering, self-harm, and eventual suicide. Well, now comes a major study out of Finland, and it says something the activists are absolutely going to hate. It says the mental health problems did not get better post-transition. In some cases, they got way worse. This is published in Acta Pediatricia just days ago. The study looked at 2,083 adolescents and young adults in Finland who were referred to specialized gender identity services before age 23 and compared them to 16,643 matched controls, so kids that weren't referred to gender identity services. It tracked severe psychiatric morbidity before and after the referral. And the findings are absolutely brutal. For the activists' favorite talking point. You know that talking point. Would you rather have a trans daughter or a dead son, right? That emotional blackmail. These youth in the study already had significantly higher psychiatric morbidity, so psychiatric problems, than the control group before the referral. And they still had dramatically higher psychiatric morbidity at least 2 years afterward. The paper's abstract says that among adolescents who underwent medical gender reassignment, psychiatric morbidity, those psychiatric problems, increased markedly during follow-up, rising from 9.8% to 60.7% in the feminizing group. So that's the male to female transition group. And from 21.6% to 54.5% in the masculinizing group. So that's the girls who went from girl to boy. The study's conclusion was plain. Psychiatric needs did not subside after medical gender reassignment. And in the majority of cases, they got much worse. Now, to be careful and fair, this is an observational study. It doesn't prove that the interventions caused every worsening outcome, but it absolutely does destroy the sales pitch that these interventions reliably improve mental health. If the entire public argument for rushing vulnerable kids down this irreversible pathway is that it makes them psychologically better, then a large nationwide study showing no such improvement is a very, very big problem. And here's what makes Finland so important. Finland didn't just stumble into this debate yesterday. Finland has been dealing with this issue at the clinical and policy level for years. In 2020, Finland's Council for Choices in Healthcare issued guidance saying the first-line treatment for minors with gender dysphoria should be psychosocial support, psychotherapy when needed, and treatment for co-occurring psychiatric disorders. In other words, slow down, assess thoroughly, treat the psychological conditions, and do not treat medicalization and surgery as the automatic first answer. Why did Finland move in that direction? Well, because their health authorities concluded the evidence for pediatric medical transition was weak, and because these young patients often present with serious mental health complexity that cannot just be waved away with a new name and some surgery and a lifelong prescription. That is the part the activists hate the most. The possibility that gender distress does not exist in isolation. These are often not otherwise healthy kids with one single issue that can be solved by hormones and surgery. These are often deeply distressed young people with overlapping psychiatric needs. Finland's own recent and earlier research points in exactly that direction. The new study found that severe psychiatric morbidity was common among these patients and even more prevalent in the latter referral cohort. Earlier Finnish work also found that when the psychiatric morbidity is taken into account, the simplistic suicide narrative just collapses. That matters because the whole political machine around youth gender medicine runs on the emotional blackmail I mentioned earlier. Question this and you want kids dead. Ask for evidence and you're hateful. Point to weak studies and you're accused of bigotry. Suggest therapy first and suddenly you're the villain. But science is not supposed to be a hostage situation. And what Finland is showing again is that vulnerable kids deserve real medicine, not ideology dressed up in a white lab coat. Because if treatment is supposed to improve mental health, and the best response to long-term negative findings is to scream at critics and hide behind slogans, then maybe the evidence was never as solid as they claimed in the first place. Maybe it's just been a huge human experiment on other people's kids. That's been the dirty little secret of this whole field. A lot of the evidence used to justify pediatric transition has been low quality, short-term, uncontrolled, or just riddled with follow-up problems. A 2024 ACTA Pediatricia study review said longitudinal studies had not consistently shown mental health benefit from hormonal transitions and interventions in adolescents, and Finland's cautious approach reflected that uncertainty. When a country with centralized services and a nationwide health data study says actually the psychiatric distress does not disappear after medicalization, that's not some fringe blog post on a TERF website somewhere. That's a warning flare, and we should be listening. And in Canada, save for the sane exception to this madness here in Alberta, well, we should all be paying attention. Because here, too many institutions still behave as though affirmation is the only ethical option, as though asking questions is cruelty, as though parents should just hand over their child to an ideology that promises certainty when the evidence does not. But kids are not political fashion accessories. They're not a social movement, and they're not lab rats for a treatment model built on activist pressure and wishful thinking. If Finland's data shows that these young people remain psychiatrically unwell, and some treatment groups appear to get worse over time, then the humane response is not to just double down. It's to stop, pump the brakes, reassess, tell the truth, and finally admit that the slogan was never science. Because affirm or die, well, it made for a nasty bumper sticker. But Finland just handed us something more inconvenient. Hard facts. For Rebel News, I'm Sheila Gunn Reid.